Health insurance experts say the results of a political standoff in Washington, D.C. will end in steep health care coverage for millions of Americans. Thanks for joining us. I'm Kim Chapman-Whitfield.
And I'm Josh Roth. The government shutdown is now over. However, Democrats walked away from the fight without one of their key demands met. A live look, Capitol Hill now. In D.C., affordable health care was at the center of the government shutdown fight. For weeks, U.S. Senate Democrats pushed for an extension on tax credits under the Affordable Care Act.
Democrats voted to reopen the government without those credits and instead received a promise of a vote on the matter. Now, the help that hundreds of thousands of people in Tennessee depend on could dry up in a matter of weeks. News Channel 9's Ray Coyalo joins us now to tell us more. Ray.
Yeah, Kim and Josh, affordable health care was, like you said, at the center of the government shutdown, with many lawmakers pushing for an extension on tax credits under the Affordable Health Care Act. However, with no extension voted on, residents are telling me they're left wondering how they'll afford health care come 2026.
The reality is I'm not going to be able to have insurance next year.
Robert Sori is one of just over 500,000 Tennesseans enrolled in ACA marketplace plans. He showed us these letters from healthcare.gov that show the premium for the same plan had increased from the last year, which will go from $0 to $150 a month.
I understand that's not the government's problem that we feel great, but at the same time, you grow up being taught that this country will take care of its people, and it's just not true.
According to the Center on Budget and Policy Priorities, once tax credit enhancements expire, premium costs will more than double on average for residents who receive health care insurance through ACA Marketplace. I took to Facebook asking people if their insurance premiums have been affected. Residents told me their premiums increased anywhere from $200 all the way to $1,000.
With all of the otherwise healthy people kind of opting out of the insurance pool, next year it's going to be really interesting because I think this is going to be 10 times worse next year.
One Chattanooga resident sent me this, showing her plan will increase by 1,200%. Matthew Hitchcock with Hitchcock Family Medicine says, if residents like this Chattanoogan and Sori want to remain insured, they'll have to get creative.
Short-term limited duration plan, which are almost like term health plans. You get it for 3, 6, 9 months, but then you have to redo it every 3, 6, 9 months. Those tend to be cheaper.
Sori says he just hopes he can find health care insurance he can afford.
I'm 43 years old at this point. I have degenerative disc disease. I have chronic migraines, and generally I don't feel great.
Now, the temporary expansion for the Affordable Health Care Marketplace plan are set to expire December 31st. Kim?
All right, Ray, thank you. Tennesseans from every county in the state enrolled in an ACA Marketplace plans in 2025. The county with the most enrollments is Shelby at more than 100,000 people, followed closely by Davidson County.